Statistically, non-communicable diseases are said to kill about 41 million people globally each year. According to the World Health Organization, 77% of all NCDs deaths are in low and middle income countries. Because of this, the Health Association of Sisterhoods of Kenya has decided to pay focus on non-communicable diseases. This is done in collaboration with the health facilities that are under the umbrella of the Health Association of Sisterhoods of Kenya. Special thanks to the Conrad Hilton Foundation who've made this possible.
I am Sister Regina Ndenya, working with AOSK, coordinating HASK. HASK stands for Health Association of Sisterhoods of Kenya, which is the umbrella body for all the health facilities run and managed by sisters in Kenya. We have been carrying out several projects in this association, which is made of over 110 health facilities across the country. Currently, we are implementing a non-communicable diseases project with 82 health facilities consisting of levels 2, 3, 4, and 5 across the country.
From 20th of March to 19th of April 2023, the Health Association decided to pay a support visit to a number of health facilities that are implementing this. The health facilities that were visited included Mutomo Hospital, Mudale Mission Hospital, St. Mary's Hospital in Nakuru, Our Ladies of Lord's Muir Hospital, and Raroa Health Center in Homa Bay. This is what was being implemented as explained by the health facilities health practitioners.
We have been doing screening for the whole of this week. On Tuesday, we visited the market. People were screened in the market, and so many were found to be having issues with their blood pressures, were referred to the hospital and were treated. And they were very happy in the market as the screening was going on when they were still doing their normal businesses.
The purpose of it was to screen non-communicable diseases such as diabetes, hypertension, and also screen other cancers like cervical cancer, breast cancer, and also prostate cancer. Part of that was to ensure that patients are also taught how to screen themselves. For example, female patients are taught how to do self-breast examination, and also how to create awareness within the villages. Me as an orthopedic clinician, we take part about screening patients in terms of ensuring that our patients who have degenerative diseases of the spine, of the knee, or any other joint within the body was done to maximum level, and also ensuring any sport medicine illnesses like for example injury to the shoulders, hip joints, and any other joint was also sorted out.
Right now, HASK is supporting our NCD week and these programs that will follow it for the whole year up to 2024. This week we are offering free screening for hypertension, for blood sugar, for weight monitoring, mental health, cervical cancer screening. And we have so far screened about 300 people. We have 2 clients that have turned positive after cervical cancer screening, which we have referred to the county referral hospital for further management, and we'll still continue. We are very grateful to HASK for this support.
I would want to thank the Health Association of the Sisterhood of Kenya for having found it necessary for us to reach out to our community members so that we can help them take care of their own health. Today we are carrying a free screening for non-communicable diseases, specifically diabetes, hypertension, cervical cancer and breast cancer, prostate cancer, and we also took the opportunity of giving health education around mental health, mental health and wellness, because this is one area that we can easily forget. And we all know through the stresses of daily living, this is one area that we must not neglect.
Through the efforts of HASK program, a number of health facilities that were almost dying have been revived back and are currently performing well. Sister Monica, an administrator of Mudale Mission Hospital, gives a testimony of how the facility was once degraded because of not meeting the required standards.
Through the outreach services, we were able to revive the hospital. We have actually changed the face of the hospital because patients had almost disappeared. At one point we were degraded because we didn't meet the level 4 standards by the board. So patients ran away from us because NHIF could not support our services at level 4. But through the outreach program supported by the Association Sisterhood of Kenya, the Non-Communicable Disease Project, we have been able to reach so many communities with different messages, different screening and free services in the communities, and that has helped us to draw patients back to our facility. So we are now seeing the numbers increasing. We are seeing a change. Our admission numbers have increased. Our outpatient flow is better. And people generally in the communities are really appreciating the services that they are getting.
Why is there a need to pay focus on non-communicable diseases and not any other types of diseases? Dr. Peter Kilonzo explains.
We are focusing a lot on the non-communicable diseases, which includes diabetes, hypertension, mental health, cancers, etc. Diabetes and hypertension are on the increase, and the main thing with them is quite a number of the patients are symptomatic. Hypertension is a silent killer. Patients will just drop with a complication when they have had no symptoms at all. So therefore, we are encouraging our people from around this hospital to be coming down for screening. Screening is very cheap. Today we picked a lot of patients who have had hypertension for long and they are not on treatment at all. That's a very important concept in terms of preventing the complications of non-communicable diseases. Regular medical checkups at least once a year will go a long way in preventing patients from presenting with the complications of the non-communicable diseases. Once it is also known early, like cancers, diabetes and hypertension, treatment is started early and health habits are encouraged to make sure that the disease progression is slow or does not happen.
The overall feedback from the beneficiaries of the free health services was positive. They had the following to tell the implementers of the activity.
Our blood samples have been taken for laboratory work to check the general health of our body. Apart from the laboratory services, we have also had our weights taken, we have also had our heights taken, and we have also had our blood sugars taken.
Kwa siku ya leo naona na faida sana kuja hapa Mudale kupimwa sukari na pressure bila malipo yoyote. Kwa hivyo nafurahi sana kwa vile hii huduma iendelee hivyo hivyo.
Nimekuja hapa hospitali kwa sababu nimesikia habari ya huduma itafanywa ya bure. Kwanza nilipimwa pressure, kisukari na height ama urefu. Na kutoka hapo nimekuja kupimwa kansa. Kansa ya matiti, kansa ya cervical cancer. Sababu ya kuja hapo kupimwa ni kwamba haya magonjwa ni magonjwa hatari. Na haya magonjwa kwa mtu akipatikana nao na kwa ni gharama nyingi sana. Kwa sababu sisi huko Mtomo ama watu wa Southern hatuna chochote.
Na nashukuru uongozi haswa hospitali hii kwa kuweza kuweka forum hii ya kuweza kufikia wagonjwa ambao pengine hawangeweza kulipa bili ya hospitali ama fedha hiyo ambayo ilikuwa mingi wamepunguziwa, na wataweza kupata matibabu kwa muda mwafaka. Ningeomba hata hospitali zingine zikaweze kuwa na aswa forum kama hii ambapo wanaweka matibabu kwa hali ya chini, ili Mkenya yule ambaye hawezi kupata matibabu akaweze kupata.